I've already introduced you, so the floor is yours. Thank you very much.
Thank you so much. Thank you for the invitation, and I sincerely regret that my training in Portuguese has not been very successful so far. I had planned to be more physically present in Portugal this spring, but as you know from previous lectures here, a virus has hit the world and prevented some traveling. But there will be life after the virus, and then I will commence my Portuguese training lessons. So,
wonderful. Thank you.
Thank you very much for the invitation. And I would like to declare that I am not a virologist, and I am not an immunologist. My specialty in this context is rather to be an optimist, I think. Of course, we are all affected by the present pandemic. It affects us all, both from a personal and a professional perspective. In the dental profession, we are working to prevent and treat the world's most common non-communicable diseases, caries and periodontitis. But now we are all affected by a quick-spreading communicable disease called COVID-19. And often a temporary standstill is imperative in many of our clinical operations. I had a role model, Professor Hans Rosling, engaged in global health. He died in 2017. You might have come across his book, Factfulness, 10 Reasons We're Wrong About the World and Why Things Are Better Than You Think. It was published in 2018, a year after his death, by his relatives. And I would recommend you, if you have a chance, to dig into that book. In that book, he admits what he fears most for the future. Number 1 on the top 10 list is a global pandemic. And it's here now. So it is not unimaginable. But we will still have to accept the present situation. In this very informal presentation, I will give you some glimpses from a Swedish dental perspective, but also some reflections with a more general outlook. The COVID-19 epidemic and possible route of infection spread by aerosol in the dental clinic is indeed a hot topic, but very little solid evidence seems to be available as yet. There is indeed a challenge to find, collect, and interpret evidence in order to improve the dental working environment, to make sure we have safe conditions for patients, for our staff, and for ourselves for the future, including the next pandemic that demonstrably will come. I am a dentist with more than 40 years of professional experience, including clinical patient management. I have a big network of colleagues ranging from my classmates to national and international colleagues. Over my 40 years of outlook, zero of my large number of personal colleague friends have passed away due to occupational infection. Please understand, I'm not trying to underestimate the risk with the present pandemic. Just want to bring in a perspective of the safety of the dental working environment under normal conditions, including spread of aerosols in the operating theater. We need to know much more when it comes to COVID-19 and the spread. We need to know much more when it comes to how aerosols infect, but still we need also to keep a little bit of perspectives. In the published reports from Wuhan, we can learn that 9 dental staff and students were tested positive for COVID-19. I had the pleasure of having personal contacts with the corresponding author, Bian Chuan, and he reports that they cannot clarify the source of virus infection for these individuals working in the dental hospital. Most likely, it refers to social interaction with family members or colleagues, even if, of course, transmission from patients in the clinic cannot be precluded. In Sweden, the dentistry for the adult population is roughly normally divided equally between public dental health and private offices. 50% go to private dentists, 50% goes to public dental health. They all serve under the same state-supported remuneration system. Now, most of the public dental health has closed their general clinics, and patients are advised to postpone their dental visits until the pandemic is more under control. All available personal protection gear is transferred to the general hospitals or to intense care units for their use in a more prioritized settings, saving lives. Dental emergencies are referred to a few dedicated clinics, and COVID-19 affected patients with acute dental problems are referred to special hospital dental units well equipped for infection protection. And having said well equipped for infection protection, there has been a shortage of the best available infection protection equipment. So we have a day or two before the stocks run out, and then it's refilled, but there is no surplus of equipment available. Many private offices are closed. Some of them have normal activities for generally healthy patients. However, a cancellation of appointment by the patients are very common. Even the generally healthy patients, they call their general dentist and say, due to the present situation in the society, I would like to cancel my appointment and have some new possibility later on. And of course, this severely affects the economy of the small private clinics, and of course even the larger publicly run dental clinics. The long-term economic impact of the pandemic is indeed worrying, not least for the socioeconomic most vulnerable individuals. When unemployment leads to worse poverty, expenses for dental care may not be on the top priority list. Most dental diseases are slowly progressing and are sometimes only noticeable after several years of neglect. This may have a great impact on future oral health for large groups in the population and may require special attention from government authorities and the dental profession. When this pandemic finally gets under control, there will be a huge need for professional dental services. Of course, adapted to the lesson we hopefully have learned from COVID-19. So let the optimists finish this short presentation with our challenge for the future. There is a world waiting for us, for you and for me, to carry on with the dental service to the public. Thank you so much for your attention.